Now here I will speak of a case which is a really tough trauma and severe trauma, and I will show a custom-made Gore-Tex artificial iris. The material was taken from the cardiosurgery, and it was taken from a vascular graft for arteria femoralis or brachialis, which can be substituted with a Gore-Tex. Now, here we have a severe aniridia and aphakia, and it was an open trauma, blunt one. What we do now is sizing the horizontal white to white and checking if our pre-made irises are fit to that size. Here you can see that we have a 1 millimeter opening in order to provide free circulation of the aqueous humor in the eye in order to not have a block. So we decided that we can suture BNL acrylos AO IOL with a proline suture to the custom-made prosthesis. The central opening of the prosthesis is exactly 3.5 millimeters, which is small enough to act as a pupil or as iris diaphragm, and large enough to not impair the night vision of the patient. We all know that if we leave the eye without any aperture, the light phenomena which it will experience will be really tough to handle, especially in bright conditions. So the next thing to do is to pass a Gore-Tex CV8 suture, which means 80 suture to the haptics of the BNL AO acrylos lens. And later on, this iris IOL complex will be put in the eye. So we need to enlarge the corneal incision at least to 7 to 8 millimeters. But before that, I will make openings which are on 2 millimeter, approximately 2 to 2.2 millimeters from the limbus, in order to provide entry point for the Gore-Tex sutures. I use 23 gauge blade because I don't want to create involuntary sickle dialysis when I pass through these openings with my instruments. Because if the tight is too, if the passing is through a tight space, the resistance between the instrument might induce psychodialysis, which might relate later on to hypotonia. Here, this is a 5.5 knife, which we will use to enlarge the corneal incision, 8 to 9 millimeter, actually, in order to put the iris and lens complex on place. So I will pass the sutures before implanting the iris lens complex. I'm using a curved instruments in a handshake fashion. Why curved? Because it's more easier to approach anterior segment with curved instruments in contrast to the straight vitreoretinal instruments that we normally have in our operating rooms. Here is how I pass the instrument through the scleral opening, and then the second suture will come out. So why I'm using Gore-Tex sutures? Because the Gore-Tex is really forgiving on the tissues, and it will last forever because it is not biodegradable. Also, all the knots are tissue friendly, they don't cut through the sclera. So in comparison with the proline suture that we normally are used to place in such conditions, This is more robust fixation. So this is the other side. And in that fashion, it's really easy to judge where you place in the centration of the IOL or the IOL iris complex. So here is the second one. And now, with something more robust as this instrument, I will put the prosthesis inside the eye. So this is our first case. Later on, probably we might see how we can fold the complex. But anyways, we will see how it will be settled in the eye. Now we can carefully titrate the tension and the position of the prosthesis. Of course, there are other options like Dr. Schmidt custom-made iris, but it is a great opportunity to, let's say, correct the aniridia, but it's not widely available, and the process of ordering is related to custom pictures, and also the price is an issue. So here we thought that with this approach we might solve this tough case. Now I place a mattress suture or envelope style suture in order to close the cornea, and later on we will fixate the iris because it's better to be done on a closed eye with normal IOP. Otherwise, our tension of the sutures might be wrong. So here, what is important with the Gore-Tex sutures is that they are slippery. So my advice would be to have a 4-1-1-1 or 4-2-1-1 fashion of tightening in order to have stable knot at the end. So the same thing from the other side. Another good quality of the Gore-Tex suture is that it doesn't stretch. So however you pre-tension the suture, it will stay like this. So the centration is really robust. What was our intention later? If anything goes well, the idea of having the white iris, of course, is not cosmetically really attractive. But with a contact lens, this might be corrected a little bit. Also, we didn't use in this case Triton blue, but the Triton blue actually stains really well the Gore-Tex texture. So we might at least have a blue iris, but this might be done in future. Now a little bit more on the knots. Of course, the eye should be well pressurized. Now, here, because I'm not using a horizontal scleral flaps, I will just rotate and bury the nose inside the eye. And that way there will be no knot left under the conjunctiva, and there will be only one white line. So nowadays I'm using horizontal scleral pockets, and under the sclera I hide the sutures, so nothing is visible even under the microscope. So this is part of the end of the case. What is important is that this prosthesis doesn't impair at all the view of the retina through a biome or any wide-field viewing system. So we can, in the future, if some posterior problem arises, we can actually treat it really well without any issues related to the artificial iris prosthesis. You can see clearly the fundus view and the periphery. Now this is the first day appearance. Then this is 6 months later, and with the contact lens. So it's actually acceptable and the patient is quite happy. What is important is that there is no endothelial cell loss, and also the patient sees 0.6 with this approach. Thank you.